Hi everyone, welcome to another webisode of The Good Doctor on EasyLiving.com. In a previous webisode, we talked about scoliosis, and we're going to continue on this conversation with Dr. Walla. How can parents, as you talked about early detection, and the first people that encounter a person with potentially with scoliosis are parents. What signals should they be looking for?
Usually at that young age, any deformity should be identified first, either at home or at school. So the child is always in the eye of the parents or the teachers. We always have just to keep an eye on the shoulders. They are at the same level. When they are changing clothes, make sure that the waists are the same on both sides, not one curved than the other. When the children bend forwards, make sure they don't have one side higher than the other on the back as well. We don't usually need to give a lot of education because parents are usually having an eye on their kids, and if there's anything wrong, they just jump and go to the doctor, at which is the right thing to be sure if there is anything wrong. There was a lot of talks about doing a screening in schools in different countries. Still, there are a lot of controversies how that is efficient, but we, as much as we can through local efforts, we try to do awareness for schools and to be a continuous thing, not just a campaign every now and then.
When you talked about detecting moms and dads, from what age should they be looking out for this?
Good question. From age 0.
Really?
Because remember in the first episode we mentioned sometimes it's a congenital anomaly.
Right.
And if it is a congenital anomaly, the spine can be curving from very, very early days as well.
And in schools, what should teachers be looking at?
A lot of kids, they tend to have like a lazy posture, as we call it. This is a posture thing that we just need to encourage them to do sports and to stretch their back, but this is not a deformity, it's a posture thing.
Right.
But what we're talking about is something persistent that is always there. And even when we ask the child to try to correct it, the poor kid cannot do it.
Now the question is, parents and teachers have detected, they bring the child to a scoliosis specialist or a scoliosis surgeon. What are some of the tests that the doctor would do to prognose scoliosis?
When we first have a patient coming to check for a scoliosis, or we can know that he has a scoliosis, like we're experts, so we can tell even by eye sometimes that there is a curve there. The first thing that I always think of, that we take a very clear history from the parents. If he ever had any problem during pregnancy, during development time, if he has any history of any other illness or disease, we want to make sure that what is the type of scoliosis he's having. Like, we want to make sure he's the common idiopathic type without ignoring or neglecting the other reasons as well. Then after taking all the history and make sure which track are we on, then we do the clinical examination where we do a lot of measurements, and these measurements will show us the status of the curve as we are today, and that would be also a good reference for us in the future to know how are we progressing or regressing and what are the results of whatever kind of treatment we are going for. In the common types of scoliosis, we need to know also the flexibility. Is the curve is flexible? Is it rigid? So we do sometimes of bending films to detect how far it can go and how rigid it is. Sometimes we need to do the MRI scanning if we are having doubt about a problem in the spinal structures as well. And in some cases, other than the common ones, we need to do some tests. But because it's commonly affecting the thoracic spine or the chest area, sometimes we also need to know if the lungs are functioning also properly and how good it is before we move to the next stage as well.
And then once you've done the assessment, what happens next?
Once we've done the assessment, to be honest, I personally like the patient, the child himself or herself, and the family to be getting more and more education at that stage. That's why we are very concerned of having a proper education materials. We use our website, and there is also the website of the Scoliosis Research Society, a lot of patients material designed for patient education in very simple words, because they need to know the journey we're going through on a very good scientific background.
Right.
We know, like a lot of us, we just get a lot of ideas from our neighbors and friends and family, based on more of an emotional rather than scientific basis. Dealing with such major spinal disorders, we should be like more as scientific as possible when we go with that. And then the next step is we decide what is the best treatment for this particular girl or boy.
Right.
Everyone is different.
Well, that was fabulous information. Thank you very much. Stay tuned for our follow-up segment, webisode, where we're going to actually be talking about two types of treatment, which is the non-surgical and surgical treatment. Thanks for watching The Good Doctor on EasyLiving.com, where you can find anything and everything lifestyle.